So cooperation between small company and larger company, why is that good?
Why is that good? At least in our business, we really need those bigger companies because we are providing solution which requires always integration to the journal system, for example. And today, at least in Scandinavia, all those players who are providing journal systems, they are those big ones. So that's why that's crucial for us.
What kind of a solution do you provide?
We are providing mobile solutions for the nurses so that nurses don't have to file, for example, patient measurements like heart rate and blood pressure anymore to the paper and then again with the computer. They can file it with the mobile application and data is going directly to the journal system.
So they can have it simultaneously in the press?
Yeah, exactly. That's the main idea, like point of care basis and they are saving time because they don't have to do double filing and nurses can focus to the patient instead of the computer.
What kind of difference do you think does it make for the patient?
For the patient, the biggest difference is that nurses and caregivers are having more personal time for actual care for the patient. I think that's the most significant thing, definitely.
So how did it work, this collaboration with the larger company?
I believe it works very well, and it's up to us mainly how it works because we have to prove every day that we are bringing value. That's partnerships works like that. You have to bring value, you have to build trust relationships, and if you're able to do that, then it works. Same thing with the customers.
Okay. Do you deliver to the larger company or do you have the care system as your customers?
End customer is always hospitals or healthcare regions. We are providing solution which is integrated to the journal system. In Finland, we have provided our solutions directly to the hospitals and healthcare regions, but for example, here in Sweden, we are operating only through partners, and I believe that's the only way.
Why is that different here in Sweden?
We need that partner to handle, like, for example, support with your mother language. Before this interview, I showed my Swedish skills. Those are not so good yet. So we need partners, for example, for support. We need them for deliveries, and of course, for the sales power also.
So are there any difficulties with this collaboration?
Maybe the main challenge is that how to build that partnership, how to get into those partnerships, because those journal system providers, for example, they are big players, and there is everyday company like Medanet knocking on their door. So I think the main challenge is to get that door open and then prove that we are worth of that trust from them.
What do you think about the innovation skills that you smaller companies have? Do you have more power in innovation?
I think everyone is saying to this kind of question that yes, we have, but of course that's what we try to do, and we try to be innovative and invent new things. But in the other hand, it requires also a lot of patience when you are dealing with the healthcare, and especially when you are dealing with the public sector healthcare. It requires patience. But we need both innovations, courage, and also patience.